Good evening, Mr. Freeman.
President Arnold, Superintendent Allison, members of the board, once again, we go down the path of another budget development report. And this one, I hope, is kind of the last piece of the puzzle that will allow us to go ahead and build a balanced budget. In phase 4 of the considerations that we've made over the last several months, as a matter of fact, the health plan recommendation comes to you as a final recommendation, and would point out to you that the health reserves and the health plan was the very first thing that we actually started discussing because of the size of the cost increase that we were looking at. So we've worked for several months now trying to develop this. And the Employee Health Advisory Committee, the EHAC committee, has recommended health plan changes which will reduce the cost by $3 million as we've talked over the last couple of meetings. And I'll detail those as we get on into this. In phases, so phases 1 through 3 that we've already approved, plus the health plan changes and the shortened student calendar, is going to reduce our costs or make adjustments to our budgets by that $22.7 million. And with those reductions in place, we will be able to build a balanced budget for next year. So the Employee Health Advisory Committee has met, but I want to talk a little bit about the committee first. This committee is made up of members of the 3 bargaining units, UTW, SEIU, and the security group, plus the KZ employees, administrators, and retirees. The group has been in existence for quite a number of years, and their role is to review and oversee the status of the health plan and to make recommendations. One of the real strengths of your health plan is this committee. They really do understand what has to happen with these and the control that we place on our fully our fully funded plan that we have in place. The committee did review 2 plan options on May the 27th and recommended an option 1, which I'll show you in just a minute, that has some premiums and deductibles. Of the 2 options that they looked at, option 1, the premium's a little bit higher, and the deductibles were a little bit lower than the other option. So that's the one that they wound up choosing. Other recommendations from EHAC that we've already talked about that I'll go over again is also to help ensure the financial solvency of the plan. And I would indicate to you as we looked at many options with regard to this, we had a lot of great help from our consultant, Aaron Wells with USI, Angela Blake in the benefits department, really worked diligently to try and help develop these. We we projected out what this would do for us not only in the next fiscal year, but the fiscal year following. So the recommendation that you're going to see here, in my opinion, will fix us for at least a couple years out, so we won't have to be coming back and looking at this again next year for the same reason. So that being said, we'll walk through the recommendations. All of these changes will take effect on January 1st, 2017. Utilize the POS network. This is basically where a network of doctors that are primary care physicians. So employees will be asked to have a primary care physician. That saves us quite a bit of money on the cost side of it. We are going to offer separate enrollments for dental and medical coverages. And there will be 2 employee medical plans, a base plan and a buy-up plan, and 2 employee dental plans, base and buy-up. So each employee actually has 4 choices to look at. They can pick and choose between whichever ones fits best with their financial situation. The retiree recommendation, as we've discussed before, is to tier the premiums, and by tiering I mean you'll have a premium for an employee plus children, employee plus spouse, and family. So those are the 4 tiers that we're looking at. The spouse of a deceased retiree would be offered COBRA for up to 36 months. Retiree and spouse would be offered COBRA once the retiree turns 65 for up to 18 months. And we will offer the retiree the medical plan that's the same coverage as the employee buy-up plan. And I'll show all of these in later slides. And the dental plan will offer the retirees the same coverage as the buy-up plan. The retirees, we will only offer 1 set of plans, not 2 like we do with the rest of the employees.
Oh, you took your name? Okay. Are you at a point where I have a couple of questions?
Sure.
Okay. This does not prohibit employees from going out of network, does it? Is there just a penalty if
There's higher costs.
Higher costs.
There's higher costs
so
to
they
them
still
for
would
being,
have that option.
Yeah.
Yeah.
There's higher costs to them. Their co-pays and those types of things
Right.
will be higher if they're out of network.
And then on the retiree, which it's talking 65, so that's Medicare eligible. This then would be secondary? This insurance would then be secondary to Medicare?
Well, a retiree that has reached age 65 is no longer on our plan. And what this is talking about, if a retiree and spouse, once the retiree reaches 65, the retiree is going to go off the plan. But in the past, the spouse, if they were under 65, could stay on the plan. This changes that so that once the retiree themselves reaches age 65, they'll go off the plan and the spouse will be offered the COBRA. So once you reach age 65, you're off of our plan.
Okay, maybe I'm not following. Retiree and spouse would be offered COBRA once the retiree turns 65 for up to 18 months. Maybe I'm not following.
It's really the spouse that gets
It's
offered.
the spouse.
It's the spouse that gets offered
Okay.
the COBRA.
Okay,
Right.
gotcha.
Yeah.
That was a little confusing
Yeah,
to me.
sorry.
Okay.
All right. I know this is a little hard to read because it's so small. There's a lot on this page, and we provided you with a printed copy of this. And I'll try and talk through some of this, but there's several pages here that look at the various options that are here. This page is the medical plan, and the column that says current is what the current plan is and what the current premiums are. On the left-hand side, it talks a little bit about the premiums, and of course all the wellness pieces still apply here. So you have to have your wellness points, or you have an additional premium on top of what's listed here. And the thing I want to point out too is that the actual monthly premium amount will vary based on employee-specific pay calendar. So what you see over on the far right-hand side with the buy-up plan and the premiums that are there, that's a monthly premium if you're paying 12 months. Okay, and later on I'll show you the annual amounts there, which makes it a little bit easier, I think, to figure this out. But for instance, we have a lot of employees that only get 20 paychecks a year. Okay, so whatever the annual premium amount, the one that they select, is then divided by 20 to produce the premium that's deducted from their paycheck. So that's kind of how it's stated here as monthly plan, but that's only monthly for employees that get paid once a month, 12 months a year. The others will, and we'll provide a lot of information as we get closer to this and open enrollment and that sort of thing for employees to try and educate them on what this means and what it looks like for them. But as you can see, the basic plan has 0 premium, but you'll notice that the Deductibles are higher, and the out-of-pocket maximums are different. The one thing that we were able to do is the prescription out-of-pocket maximums actually went down on these. And that's a lot in effect because of the change over to the Maxor prescription drug third-party administrator that we're currently using. So you can see that the basic plan there with zero deductible, but the higher zero premium, but the higher deductibles, and then the buy-up plan with the premiums that are listed there. And I would indicate to you, one point you looked at a premium plan that had zero for the employee on the premiums. Well, after the analysis that we ran on that, there was a considerable amount of adverse selection with that type of a plan. So we needed to go to a premium for that employee only. Okay, any questions on this page?
We have a question from Lynn.
These are all pre-tax dollars,
Yes.
so employees won't be charged their Social Security tax and anything else on that. So it ends up being a little bit less for them in some
Correct.
cases. So,
Yeah,
okay.
Depending on where you are in a tax
Tax
bracket,
bracket, all that,
it might
yeah.
be 15 to 25%, perhaps even.
And then if they want to cover their deductibles and things, they can take that in their flex plan as well, which is also tax deductible, for a contribution. Is that correct?
That is correct, yes.
Okay, good. And do we have a lot on a flex plan?
I really do not know
No?
for sure.
Okay. That may be something we want to encourage, staff to use.
And like I said, once we will develop the educational plan and information that goes along with this to help employees know what their choices are.
We have a question from Barb.
Thank you. Quick question. Do we have any vision plan in this?
It's the vision plan. I thought about that as it stays the same. It is part. It's actually there's a separate insurance plan, but it did not change at all. It's the same as it has been.
So is that the one that says specialist visit co-pays?
No, I think the vision plan stands separately by
And
itself.
it's not anywhere
No.
in the information we have?
No.
Okay. Thank you.
Other questions on this page?
I
We'll
think
go
we're
to the
ready
next
to go
page.
on.
Next page is dental. As it indicated, we've separated the dental out from the medical. And again, the left-hand side talks about the premiums, and the coverage summary might become important when you start to look at what the benefits really are. But the basic plan, again, has no premium with it. But when you look at the benefits down below, you'll see that there is no deductible. However, the basic plan only covers diagnostic and preventative. So the basic and major coverages are not covered under the basic plan. If you look over on the left-hand side, you'll see that basic means extractions and crowns and root canals, and the major is bridges and partials, those types of things. So those things are not actually have any coverage under the basic plan. So if you went to the dentist and had to have a root canal, you would pay full price for that if you had that plan. But the diagnostic and preventative, as you can see, are how they're covered there depending on what the provider level is. So the premium plan that is there, the buy-up plan, does have some deductibles in there, and it does cover everything. It's basically, if you look across, it's basically the same plan that we have right now. It's just there's a premium applied to this.
Joy has a question.
I'm sorry, I'm trying to read this screen. It's
Sorry.
really tiny.
Yeah, sorry.
Yeah, I probably should have brought mine. This, on the left-hand side, it says no orthodontic coverage on any of the plans. Do we currently cover orthodontia? Okay, so that's the same.
That's the same.
So what you're saying is the basic plan covers diagnostic preventative. Does that include a filling, or is a filling basic? So if you have a kid that has cavities, a lot of cavities,
You want the buy-up plan.
you might want the buy-up
Yeah.
plan. But if you have family that doesn't really get a lot of cavities, then you could pick this one as long as you kept your teeth clean and checked them then if you had a cavity. Last time somebody in our family had a cavity, I think it was like less than $100 for the whole thing. So maybe you wouldn't. I don't know. Okay.
Mhm.
Thank you.
Okay. Any other questions here? Okay. The next is to look at the retiree, both medical and dental. And as I indicated, retirees don't have a choice of 2 medical plans and 2 dental plans. We decided to offer them just what basically is the buy-up plan for the regular employees. And again, you can see over on the left-hand side some of the eligibility pieces that are there, and all of that pretty much remains the same. And then you can compare the current to the medical. And the current plan has the dental embedded in it, so we're splitting out those two. And if you add up the retiree only, the single premium for the medical and the single premium on the dental, it's still below the monthly premium under the current plan. If you add those two together, it's a little over $563 per month, where the retirees right now are paying $648. So it's actually a decrease in the premium to be able to keep pretty much the same coverage, but you will notice that the deductibles on the medical plan did go up the same as they are on the buy-up plan for the employees. The dental plan is the same as it is right now. Any questions here? Okay. All right, this next slide, there's a lot of stuff on here, so I'll try and explain this. We looked at area school districts, and there are 6 area school districts that we looked at in particular. These are ones that are basically touching the Wichita Public Schools on boundary sides. And this is where I looked at annual amounts on the premiums, just to get a different perspective on that comparison. So in the left-hand side of this page, the annual amounts, health only. Some of, all of the area schools also separated out dental as well, but all of them were very similar to ours. But when you look at health only, we looked at the 6 area school districts, and the one that had the lowest premium for a single was $194 per year annual. That's about $16 a month. But then the deductible that went along with that premium was $5,000 a year. Okay. Then we looked at the area districts that had the highest single premium, and that's $3,912 annually, and their deductible that went along with that plan was about $1,500. Now, on the other side of the page, you can see what our recommendations are. So our low one is the 0 premium, so no premium and a $4,500 deductible. Okay, and then our buy-up plan is only $666 annually for the premium and a $1,500 deductible. So I tried to look at a comparison here to compare what our competitors, I guess you might say, are out there. And so below the light blue line there, now we're looking at the family premium. I didn't break out all of the tiers. We just looked at the single and the family. So the area districts, the lowest premium generates a $6,531 annual premium with a deductible of $2,000. The on our side of it, the family, the base plan, 0 premium and $9,000 deductible. And again, the deductible, when you're looking at a family, it would be $4,500 for a single person there, or if it's more than one person, then it's $9,000. So it basically doubles what you had up above. The area high family premium is over $15,000 with a $3,000 family deductible, where you can see ours is a little over $2,000 premium, annual premium with a $3,000 deductible. So then on the lower right-hand corner of this, I tried to compare these, and basically I added the annual amount for premium and the annual amount for the deductible to compare. So the area single premium, a single plan, ranges from $5,100, almost $5,200 to $5,400. That's a combination of premium and deductible, compared to the single on the Wichita Public School side of a little over $2,100 and up to $4,500. The family plan down below, I'm looking at that number's not right. Yeah, the family plan down below for the area districts is between $8,500 and $18,000, compared to $5,000 to $9,000 on the Wichita Public School side. So this is, again, just a way to kind of compare this and look at that to see where ours stacks up against our neighbors that are out there. On the left-hand, lower left-hand side of that is the board contributions in the other districts, with a low of about $2,400 to a high of $6,700, and Wichita Public Schools currently contributes $7,080 annually per employee. So a lot of numbers here. What questions might you have?
Lynn has a question.
Okay. If we look at this chart here on the family base plan and the family buy-up plan, and again, just for comparison, I'm a recent retiree. I spend about $13,000 a year on health care. I am glad to have it with my wife's, medical history, but it's a big expense. And I guess I'm not saying that to downplay this at all, but under the family buy-up plan, the $2,000 premium, we have to look at it. It is a cut of their pay. I mean, there's no doubt about it. Every staff person is going to affect that. But what staff are going to have to do is really look at what is the best plan for them. And what worries me is that $9,000 deductible, because to reach that $9,000 deductible, that's much more than what most people have in savings. And to put that into a health savings account, that's a big chunk, as well. But if they didn't think they were going to have any major operations or whatever, they may want to look at the buy-up plan. It would cost them a couple thousand, but it would still be less, with the $3,000 deductible and the $2,000 premium, that's still less than the $9,000. So will we have staff that will help our staff, go through those different options and have them look? I mean, if they've kept track of what they've spent the last few years and things of that nature, is that?
Yes.
Okay.
We've already started looking at what that education plan might look like, and as we get into the fall of the year, in preparation for open enrollment, we'll be trying to provide as much information and answer as many questions as possible early in that process, so that employees have a chance to make some decisions about what they're going to do.
Okay. And I guess one of the things that I always worry about with deductibles is particularly people that have very expensive medicines. Mm-hmm. Does that count with this $9,000, or is that separate?
That's a separate out-of-pocket.
Okay, so depending on which option they have, it could either be $1,000 or $2,000 or whatever the other one was. I can't.
Yeah, and the out-of-pocket on the prescription drug actually went down a little bit
for both of them. So
for both of them,
so they're used to that. So that would not go against their other deductible from that standpoint.
That's correct.
So okay.
Yeah, and go ahead.
There's another question, but I'll let you finish your thought, please.
That's all.
Is that it?
Thank you.
Okay, Joy?
Not quite. Almost.
Okay.
Go ahead.
Well,
Now-
it's not about
now's
the
as good a time
slide
as,
at all.
as
so,
any. So
okay.
you're,
Well, the first question I had for you was, you said this was recommended by EHAC.
Mm-hmm.
Okay, so I'm glad we went back and and worked with them and got something that they could recommend. And it does meet the $3 million that we need to meet in cuts.
Yes. Yeah.
Okay, in reduction of
Mhm.
this cost. All right, and then where I think I'm struggling a little bit is, are these the same premiums that you brought to us before?
No.
Okay, I'm not sure what the differences are in the premium now versus the one you brought just before. Are they higher, lower?
Well, it's kind
For,
of...
not for the retiree
Yeah.
or the dental, just for the medical
It's kind of a
plan.
combination. I think one of the original plans that I showed you had a zero premium for for a single employee, and what our consultant worked at there is the adverse selection that created about having a zero single and then the other tiers versus no premium at all on the on the basic plan. So it created an adverse selection for that minimized the savings that we would have. So we tried to analyze what the savings are, and these plans are designed so that if every employee took the basic plan, it would generate the same savings and revenue as if every employee took the buy-up plan. So it doesn't make any difference which plan the employee takes, will wind up in the same place. And so what happened on the premiums is that the premiums that you see here that we looked at is a little bit higher than what we had before, but the deductibles and the other benefits down below that are a little bit lower. We did look at another plan that had a little bit lower premiums up above, but higher deductibles. And EHAC recommended this plan with a little bit higher premiums and a little bit lower deductibles and co-insurances.
Okay. And then Mr. Rogers mentioned something about a health savings account, but this is not this doesn't qualify for a HSA,
No.
right?
Does not.
Okay. Do we have an FSA?
Yes.
And does this qualify for that?
Yes.
But this limit for FSAs are something like
It's $2,500, I believe.
$2,500 a year, which doesn't cover
Yeah.
the deductible. So you can only really put away a piece of your deductible if you choose the one with the $9,000 deductible. Okay.
Correct.
And then if you don't use it by the end of the year, you lose it. Is that still the rule for that?
I would say that we did talk about in a couple of the EHAC meetings about an HSA qualified plan, a qualified high deductible plan. And so there was some discussion about that. One of the drawbacks to that HSA high deductible plan is that we didn't have the control over the prescription drug side of it that we do with this one, because we still are will continue to offer free diabetic supplies, free blood pressure medications, and with a qualified plan we couldn't have done
You
that.
can't do that
Yeah.
with a qualified plan. Okay, and, all right, so was it an overwhelming agreement by EHAC, or did we barely skate through?
Well, there was. I don't know the actual votes. I was not actually at the meeting, but the vote that approved this one, it was there was a pretty good majority in it. There were some votes against it, but it was still a pretty good majority.
Okay, thank you.
Mike has a question.
We've talked about healthcare for a long time,
Mm-hmm.
and we've gone through a lot of different options, and I just want to make sure that in my mind that I'm clear. We talked about using contingency money at one time to bring the reserves up.
Mike, they're having a hard time hearing you.
Oh, I'm sorry. I'll yell. Are we still using contingency money to bring our reserves up with this, or this one doesn't need it, if I remember right?
That's correct.
Okay, I couldn't remember which way we ended up.
We are going to use some general fund money,
Right.
but it's not contingency.
Okay, thank you.
Okay, go ahead.
All right, so Phase 4, Health Plan Recommendation. Administration recommends the Board approval of the EHAC Health Plan recommendations that was just presented.
There's no formal approval this evening, but this is for information, comment, direction that we would need as we continue to move forward with finalization of the budget.
Okay. Joy?
Okay, if we're not approving it tonight, then I would really ask for a readable. Can you send us this in our email or something so we can read
Sorry.
it?
Yes, I will.
I know you're trying to save paper. I appreciate that.
We'll get you an 11
Yeah.
by 17.
I have some, but I still can't read.
Well, I probably should have given you the bigger copies that I
Well, then
have.
that would use twice as much paper, and that would be a cost. So.
Anyway, based on, once we get this piece approved and the other things that have happened, the staff, well, they're actually already in the process of building the budget. We'll put all of the pieces together, and it's quite a process, and it'll take us some time. You probably won't see a preliminary budget until July 18th, but it's going to be based on everything we've talked about at this point. We have a meeting on June 20th. I'll update you on where we are with that process and how things are going with it. So preliminary budget look July 18th, July 25th. We will ask you to determine when the budget hearing date is by approving the notice of hearing. This is what we've always done in the past. And we'll recommend that the August 8th board meeting be the hearing date and the possible adoption. Now, these dates are our projection. If something happens along the way that we can't meet these dates, we have another 2 weeks after the August 8th meeting. We'll have another meeting before the deadline of August 25th when the budget has to be adopted and sent to the county. So we've got a little bit of leeway in that, but this is the timeline that we've tried to maintain before. Last year we pushed it out a little bit later. Year before that we were on this timeline. So, any questions?
Joy has a question.
I just have a practical question.
Mm-hmm.
So if we were to have a shutdown, the deadline for the budget to the county is August 25th. Is that what I just heard you say?
That's correct.
So what happens if we don't give them a budget on August 25th because we haven't been able to finish it?
Well, I
Or we're not,
can't.
you're still not working?
I can't commit to anything, but I know the county will work with us if it's not going to be too much after that. Now, if we're shut down in August, I don't know what's going to happen. We don't know.
Okay.
and
It's not law we have
Yeah.
to have it. That's their deadline, but we'd have to go work with the county.
It's
the law.
in
It's
the
the law.
statute.
So by
It's in
law,
sta-
we have to have our budget to the county by the 25th.
Well, we have
of
to have
August. Our mill levy
we have to have an
rates.
approved levy to the
Yeah.
county.
If,
Okay.
can I add to, I mean, if I understand it, if we don't have a levy, they don't collect it, and we don't get anything for the year.
Right.
So it makes, those are some of the unintended consequences that many in the legislature aren't thinking about. Plus, there was some talk at one time, about us being able to maybe possibly raise our mill levy, and, of course, that's been thrown out with that Supreme Court ruling that whole bill was unconstitutional. But, if they don't let us levy the LOB by August 1, by the time we do our hearing, we will have some difficulty ever charging it. And the state was trying to say, well, they could come back and do that late, next session. Well, no, if it passes that August date, we're out of luck, and they won't collect it in January and June when we get it for the year. So
Yeah, that's correct. We have to produce a balanced budget. Now, we could do that pretty quickly just by putting some big numbers in and producing that budget. But yeah, we've got to have something in the county so that they can levy the taxes.
Okay,
And
thank
that's
you.
where they would give us some leeway, but I think more than a week is probably more than they'd be willing to give us.
Okay, thank you.
All right, looks like you've exhausted the board members.